So we're off to Sydney today from Perth. We've got a 70-year-old male who is a COVID patient that's recovered. So he was on a world tour on a boat, unwell, landed in Italy, repatriated back to Australia through normal commercial flights and became unwell during quarantine, went into hospital, spent 11 days in ICU, ventilated. His total admission is 6 weeks. He's got a low respiratory tolerance as a result of it. He's got some underlying disease that he wasn't previously known. So his x-ray looks poor, the CT, his lungs look terrible, but he's mobilising, he's off oxygen, but he does have quite a high heart rate, which is now part of his ongoing cardiovascular issues. So look, he's going to be fine. Anxiety's a little bit there. It's the first time he's been outside. He's discovering the new world that we're in, and he's going over to Sydney and then home. That's our story. We'll give you an update later. So on the leg to Sydney, client's doing well. He's took off, went to altitude. His saturation's about 92. It slowly dropped down to about 88%. His heart rate remained around 105, which was terrific considering he's sitting about 130 when he's anxious. And so we just put him on 1 litre, and he dropped up to, or picked up to about 93. Then we put him on the 2nd litre, he went up to about 95. He went and had a sleep. So he had his mouth open, he was mixing air from the environment around him, so his oxygen levels were probably going to drop down. So that's why we ran him on the extra litre. We had a 2.5 hour delay getting out of Perth, which caused a few problems. If we were on cylinder gas and we had a 2.5 hour delay, that would really compromise how much capacity we'd have for the flight. So lucky for us, he was on remand, not needing the gas on the ground, and then waiting for an unserviceable aircraft to be fixed, repaired or swapped out, which is what happened. So there we go, he's doing well, he's relaxed, comfortable, breathing well, heart rate's nice and controlled, about 105, oxygen levels are 95, and he's had a little snooze, so he's feeling great. That's it, thanks very much.
So he arrived back safely, and we had a good outcome for him and the family. So one observation with COVID patients that are in recovery is they've got a high level of anxiety, and we've seen this with a number of clients who've had. There've been such shortness of breath when they were on their boat or in the holiday destination or in the hotel room. They felt abandoned and left behind, and the world changed so rapidly around them. The shortness of breath does induce a lot of anxiety, and any fear of flying gets even worse. So we had a really high heart rate of about 130 beats per minute, just sitting on the ground doing nothing. And once we went to altitude, that dropped back down to just over 100. And then once we landed and went into the new environment at the hospital, it went to 100. So that was the anxiety behind the scenes there. He was anxious. But you know, he had well or good founded reasons for it. He's been through a disease process with a 50% mortality rate coming out of ICU. And the second thing is they did lose a child to measles, which is a viral infection, when they were a young family, and that devastated that family. So this is the second time they've looked at crisis related to viral infection. And so you sort of understand some of their anxiety and where it's come from and how it's shaped them. And that's their story. And it's wonderful to see them that they got home, and we have a good news story out of all this mayhem happening around the world. Thanks very much. See you next time.